Today we are going to discuss about disorders of thinking or thought. So main category include quantitative or formal disorders of thinking, qualitative disorders of thought or content thought disorders. So under quantitative formal disorders of thinking, there's pressure of thought. That means ideas are arising very rapidly and in variety and it will be passing through the mind of the patient quickly. Next one is the poverty of thought. So it's a mental state of being devoid of thought and there is a feeling of emptiness. Next one is the thought blocking. In between a sentence, a person will be suddenly stopping. Then, in the case of flight of ideas, there will be rapid speech with frequent shifts, and also there will not be any logical association between the topics. Next one is the perseveration. So, repetition of a particular response, regardless of the absence or cessation of stimulus, maybe a particular gesture is repeated, or a word or a phrase. Then comes the verbigeration. There will be an obsessive repetition of certain random words. It is similar to perseveration, but the person will be repeating the words in response to some sort of stimulus. Then comes the loosening of association. There will be completely inapparent logical connections between the sentences or statements or ideas they are using. Then comes the word salad. There will be confused or unintelligible mixture of seemingly random words or phrases. Then comes the neologism. The patient will be creating a newly created word and the meaning will be unknown to others. Then comes the qualitative disorders of thought or content thought disorders. So, delusion. So, it is defined as a fixed false belief. Even if we are presenting a contradictory evidence, the patient will not accept it. Then comes the obsessions. So it's a recurrent, persistent thoughts, impulses, or images entering the mind despite the person's effort to exclude them. Then comes the compulsions. That is the obsessive phenomena in acting, usually repeated cleaning, counting, or dressing.